The State Health Laboratory is located on the campus of Auburn-Montgomery. The goal of the State Health Lab is to provide the highest quality service possible for the healthcare provider by performing tests and reporting results in an accurate and timely manner. In addition, the State Health Lab assures accuracy of testing by following accepted procedures for quality control. The NBS division of the State Health Lab processes approximately 125,000 newborn screening specimens each year. A total of 13 staff members process and test all of the filter paper specimens that are received by the lab. Here's an overview of how the process works. The mail arrives by courier from the post office between 7:15 and 7:30 each morning and typically consists of approximately 600 specimens. Some days there may be as many as 900. The specimens are sorted according to A and B filter forms. Specimens that arrive in boxes and large envelopes must be removed and sorted. Here, filter paper specimens are removed from plastic bags. Under the guidelines for shipping, filter paper specimens should not be enclosed in plastic because it may create moisture and cause damage. After the specimens are sorted, the envelopes are opened. The specimens are taken out of the envelopes and the protective flaps are removed. As the technologists remove the flaps, they also review for missing, illegible, or inaccurate demographic data. These specimens are set aside. There must be enough information to identify the baby and evaluate the test results in order to run the sample. If demographic errors are found, the lab staff must call the submitter of the specimen to verify data on the filter form. This process may delay results from being reported in a timely manner. Newborn screening laboratory personnel closely examine each specimen that arrives in the lab for quality and quantity before testing begins. The specimens are sorted by ones deemed acceptable or questionable. When a technologist determines that a sample is acceptable, it is not reviewed again. Acceptable specimens are sorted by A and B filter forms. A barcode is then applied to the front and back of each specimen. This barcode allows the samples to be tracked in the system. If samples are acceptable, they're processed immediately. If samples are questionable, they are not processed until thoroughly reviewed. This may delay reporting of results and possibly the diagnosis and treatment of a disorder. While the technologists are reviewing the specimens, other technologists will be looking at results from overnight. The technologists must prepare to run the specimens received that day. The specimens are prepped in the morning and may take up to 12 hours to result. The tests are loaded on each instrument and run overnight. The next morning, the results are in the computer and ready to be reviewed and reported. The state lab reviews about 100 samples daily that are questionable, and about a third of those may be accepted once they're reviewed by the supervisor. 2 to 3 technologists look at all questionable specimens, and then a final decision is made by the supervisor. The lab supervisor must manually determine if the blood spot is adequate for punching. Every effort is made by lab personnel to get at least 8 punches from the specimen.
We have 3 automated dried blood spot punchers that have the capability of punching 6 plates at a time for all of the analytes that we test in the laboratory. Punching is done as close to the center of the dried blood spot as possible. That is one reason that we like and encourage everyone to completely fill the circle and make sure you have a nice good drop of blood. That is going to give you your best test result.
The lab supervisor uses a template taken from the automated dried blood spot puncher in order to measure the blood spot. The punches must be collected from the center of the blood spot to ensure even concentration of the blood.
After the specimens have been checked by the technologist to determine if they're acceptable, then the supervisor checks behind them. We look to check to see if the sample has enough blood. These blood spots are too small to use, so we can't use those. And there's not enough blood, so that's not an adequate specimen, and that would be unsatisfactory. These are unevenly saturated. The blood doesn't come through all the way on the paper, and there's more than 1 drop of blood applied to each spot. We check the spots from the front and the back to make sure that they're evenly saturated. All of these little satellite drops that are outside of the circles cannot be used because they're not large enough. The blood spot needs to be the size of the circle that's printed on the paper. Now this sample is unevenly saturated, but I found several spots that can be used, so I'll mark those and I'll measure them to see if they're large enough. So we'll measure the samples to make sure there's enough blood to punch and have an adequate margin around the outside of the spot so that we don't punch into the concentrated areas of the outside of the specimens. And these blood spots are uneven on the outside. Probably they've gotten touched with more than one drop of blood, so they're unacceptable. Initially we'll have to punch 8 blood spots, and then if we have to repeat, we'll have to repeat those in duplicate, so we could have to punch 16 more spots. But on the initial one, you have to have at least 2 nice blood spots to be accepted. It's also important that all of the information on the front is filled out correctly so that we can interpret the test results correctly. These appear to have been touched while they were still wet, so parts of the specimen have been drawn off of them, maybe back onto the baby's heel or maybe onto the collector's hands. While they were wet, they may have been laid down on an absorbent surface. Specimens that have these little satellite drops are rarely used because most of these little satellite drops are too small to use. The filter paper has been rubbed up, like while it was wet, probably touched it to the baby's heel, and then the surface is damaged. So we just say the surface is abraded, and that's what we will report that out as unsatisfactory. If you have an unevenly saturated sample such as this one, there's more concentrated areas in certain parts of the sample. So if the test is punched from one of the concentrated areas, you may get a higher test result than you would if it was punched from one area with lower concentration. And since the sample is all unevenly saturated, we really don't know which is a valid sample. This one has some clots on the back of it. It's a nice amount of specimen, very large drops, but the sample has started to clot before they dropped it on the paper, so it's not acceptable for use. Inadequate amount of specimen, because you can see that there's a nice margin around that that's not filled in. The sample should fill up that circle. This is another example of a very poor flow of blood. We've got all of the blood spots. They have a spot in every circle, and then they've added 3 more, but the 3 that are added are not large enough to use either. So even though we have 8 blood spots, none of them are large enough to use. These are a calibrated filter paper, so we know how much blood is in that circle, and we know how much, when we punch a spot out of it, how much blood is in the blood spot. But if the spot's not big enough, then it's not calibrated to that amount. Most every day we check about 100 of these samples that are questionable, and probably out of the 100 we might accept about 20 of them that we check. We're always available to answer questions anytime anybody has a question about how to collect or how to fill out a form. And we do have some training aids, videos and pictures and things like that that may be helpful. We need to test the infants early for different disorders, because some of these disorders the infant can start having problems within 1 to 2 days of life. If we can go ahead and get an adequate blood spot and a test, then we can go ahead and get those infants on treatment and possibly prevent a lot of the problems that they would have. The best time to do it is within that first 24 hours of life. So if you have to repeat it, then you've lost that window of opportunity for the best test that possible for that baby. Some of the disorders will normalize. They may be elevated in that first 24 hours of life, then they will normalize. So if you don't catch that sample early, you may not catch some of the disorders.
Forms with missing, illegible, or inaccurate information are separated and processing is delayed until the information can be verified by lab staff. They make approximately 10 calls each day in order to verify information.
Staff of the Bureau of Clinical Laboratories, the Newborn Screening Division, are highly trained professionals that are very dedicated to making sure that all the babies in our state are given an opportunity for a healthy life as it relates to the testing that we do in our laboratory. We are very fortunate in our state to be able to have the most updated instrumentation and testing procedures that are available to all the newborn screening laboratories. We are very current and consistent from state to state in offering a consistent test panel so that from state to state each baby has the same opportunity for testing. And we were one of the first newborn screening laboratories in the states to be able to offer the expanded newborn screening panel using tandem mass spectrometry and for doing cystic fibrosis with DNA confirmation. So we're very excited to be on the cutting edge with our instrumentation, with the test methodologies, and we're very fortunate to have the funding provided for us to be able to do so. We work very closely with a newborn screening follow-up team and with a wonderful group of medical consultants throughout our state who aid in following up any affected baby to make sure that they are given the appropriate care and attention that we need. And they also work very closely with us in making sure that we receive a satisfactory specimen on every baby in the state so that everyone can be tested as they should be. We hope that the information that we provided in this video will aid you in being able to better understand how important it is to follow the lab's protocols and procedures for submission of the sample and collection, getting it to us properly, for taking the test information that we provide to you and getting it to the individuals that need it, and to make sure that the babies that could be potentially diagnosed with disorder are followed up properly.
First, gather all necessary equipment: newborn screening filter paper collection form, gloves, alcohol prep, dry sterile gauze pad, heel warmer, and a sterile collection device with a point not greater than 2.4 millimeters in depth. A diaper, warm cloth, or chemical pack should be applied to the infant's heel for 3 to 5 minutes before the specimen is collected. Warming the heel is an essential step for achieving adequate blood flow. While the heel is warming, take time to verify that the filter paper has not expired, and then complete all demographic information accurately and legibly. Once you've checked the filter paper, completed all the information, and warmed the baby's heel, you're ready to collect the specimen. Be sure to wash your hands and put on gloves before you begin. When positioning the baby to collect the sample, it's helpful to have the baby's leg lower than the heart in order to promote optimal blood flow. A good way to do this is to have a parent hold the baby while the sample is being collected. Once the baby is in position, wipe the heel with alcohol and allow it to dry. Next, place the collection device firmly against the baby's skin in order to obtain a puncture that's deep enough to reach the capillary bed. Be sure to avoid previous puncture sites in the middle of the heel. When you have the collection device firmly in place, puncture the baby's foot on the lateral aspect of the heel. After you've punctured the heel, wipe away the first drop of blood to avoid contamination with the alcohol. Allow a second large drop of blood to form. If necessary, apply light pressure to the heel to get the blood to form, but be sure to avoid squeezing the infant's foot excessively. Once a good second drop has formed, touch the filter paper gently against the blood and allow it to soak through to the other side. Blood drops may be applied to either the front or the back of the filter paper. However, the entire application should be done to only one side. Do not allow the infant's foot to touch the filter paper. Each circle should be filled 90% with just a single drop of blood. If blood flow is diminished, repeat the bleeding procedure with sterile equipment. Once you've filled all of the circles on the filter paper with blood, allow the specimen to air dry for at least 4 to 5 hours. Place the filter paper card in a horizontal position away from sunlight and heat. Many physicians and hospitals will place the filter paper in a drying rack to avoid contamination. After the blood spots are completely dry, replace the protective flap and place in the pre-addressed envelope and mail to the state laboratory within 24 hours. Do not place the dried filter paper cards in plastic bags or leave them in a hot mailbox. Proteins and enzymes will be destroyed due to heat and moisture.